Hi Miss, my name is Rafi Shanalin and I am from BSN2C, and today I'll be doing my return demonstration about Leopold's maneuver. Before we do the actual maneuver, there are things that we need to prepare. So the first one, we need to wash our hands. Then the second one is we need to encourage the patient to empty her bladder. Then we need to complete the following. First, the OB score. The next is the estimated due date and the age of gestation. Then last, we need to do the physical assessment. So let's proceed to the actual maneuver. Hi ma'am, my name is Rafi Shanalin and I am your nurse for today. And today I'll be doing Leopold's maneuver, where I'm gonna put my hands in your stomach to determine the position of the baby. Is that okay? Alright, let's do it. First maneuver is also called fundal grip. This maneuver determines whether the fetal head or breech is in the fundus. It is also used to determine fetal part lying in the fundus and to determine presentation. Position the patient. Stand at the side of the bed facing the mother. Palpate the uterine fundus with warm hand. Determine which part of the baby's body lies on the upper fundus. The second maneuver, also known as the umbilical grip, used to identify location of the fetal back and to determine position. Place the palmar surface of both hands on either sides of the abdomen. Apply gently but deep pressure in one side of the abdomen. Determine which side of the uterus is the long axis of the fetus located. Then check the fetal heart rate. The third maneuver, also called the pollex grip, used to determine engagement of the presenting part and to estimate fetal station. It is also used to determine presentation and used to determine the part of the fetus at the inlet and its mobility. Grasp the lower uterine segment with thumb and fingers. Identify the presenting part and determine the mobility of the presenting part. The fourth maneuver, also called the pelvic grip, used to determine the degree of flexion of the fetal head. It is also used to determine fetal attitude or habitus and the degree of fetal extension into the pelvis. Should only be done if fetus is in cephalic presentation. Stand to the side facing the patient's feet. Place the tips of the first 3 fingers on both sides of the midline about 2 inches from the inguinal ligament. Apply pressure downward and in the direction of the birth canal. And confirm the presenting part.